Very good evening to all of you friends. In this particular video, we are going to talk about the cardiac cycle and how it works. So let me give just heading here, the cardiac cycle. So to understand the cardiac cycle, you have to understand two terms, that is systole and diastole. So let's understand what is systole. So systole means contraction and diastole. Diastole means relaxation. So systole means contraction and the diastole means relaxation. We all know that the heart is made up of cardiac muscles and heart contracts and relaxed. But the atrium and ventricles do not contract simultaneously. First atrium will contract and then atrium will relax and then ventricles will contract and then they will relax. So both for all four chambers do not contract simultaneously. Why? Because when blood is moving into the atrium, it should be transported to ventricle first. So if all four chambers will contract simultaneously, what will happen? The blood will come out of each and every opening of the heart, which is not needed. So that's why first atrium will contract and then ventricles will contract. So first of all, we need to understand, suppose this is an heart, and we all know that human heart is made up of these four chambers called atrium, and these are the ventricles. This is right atrium, this is left atrium, this is right ventricle, this is left ventricle. Okay, so let's assume that this heart is in contract. All four chambers are in relaxed state, which means it will be in first it is joint diastole. What does it mean? Joint diastole means all the four chambers are in relaxed state. So when joint diastole is there, what will happen? We all know that there are tricuspid wall and bicuspid wall in present in between the atrium and ventricle of each side. They are open. So we all know that the atrium having the blood coming from the vena cavas, superior vena cava and inferior vena cava. So atrium are filling with the blood, and at the same time these walls are also open. So what will happen? The blood will come from this vena cavas, will come first in atrium, and because these walls are open, blood will go straight down into the ventricles when joint diastole is there. So from superior vena cava and inferior vena cava, blood is coming into the right atrium, and because this tricuspid wall is open, this blood directly flows into the ventricles, and ventricles start filling slowly with the blood. So in the right side, we all know that it is deoxygenated blood, and on in the left side, from pulmonary vein, the oxygenated blood will come into the left atrium, and because this wall is also open at the joint diastole, blood will straight away go into the left ventricle, and left ventricle is also will slowly filled with the oxygenated blood. So this is what happening when joint diastole is there. One more thing you have to remember here, there are more walls which are present here. Whenever ventricles contract, these walls are opened, but at this stage these walls are closed, and these walls are known as semilunar walls. So three things you have to remember here. When joint diastole is there, these tricuspid and bicuspid wall are open and the semilunar walls are closed, and these ventricles are slowly filling with the blood. Then in the second stage, what will happen? we all know that here is the nodal tissue present at the upper right corner of the right atrium called SA node. This SA node has the ability to generate an action potential. This SA node will generate action potential which will be helping these atrium to contract. And this atrium contraction we can indicate with atriolar systole. This is the second stage of the cardiac cycle. So because SA node has generated an action potential which leads to the contraction of the both atrium, which increases this blood flow from atrium to ventricle about 30%. So when atriolar systole take place, both atrium will contract and blood will start filling into the ventricle, which was already was filling, but it will increase the blood flow about 30%. So this is the second step. Then in the third step of the cardiac cycle, what will happen? This action, when it reaches, this action potential reaches to the second node called AV node present on the lower left corner of the left right atrium. This is responsible to transmit this action potential into the ventricles through the bundle of his, and then this bundle of his will be divided into two branches called bundle branches, and then these bundle branches will be transported, or we can say spreaded all over the musculature of the ventricles. And these fibers are also called as Purkinje fibers. We all know that Purkinje fibers. So when this action potential reaches to the AV node, it immediately transfers it to the bundle of his, and then to the Purkinje fiber, which leads to the third step called ventricular systole. So this is our third step, which is ventricular systole. Okay. So what will happen? In the ventricular system, ventricles will contract, which will increase the blood pressure in the ventricles, which leads to the opening of these semilunar walls and closing of this bicuspid and tricuspid wall. Because pressure in the ventricles is increased, so that's why these walls should be closed to prevent backflow, and these walls should be opened so that this blood can move into the aorta and pulmonary artery. So this deoxygenated blood will move to the pulmonary artery, and this oxygenated blood from left ventricle will move towards the aorta, which is responsible to transport this oxygenated blood towards your body. So this is the third step, which is ventricular systole. When ventricles are contracting, both the ventricles are contracting, and these walls are closed, bicuspid and tricuspid wall are closed to prevent backflow, and these walls, semilunar walls, are open because these walls should be open because these are the doors of these vessels. So they should be open so that this oxygenated and deoxygenated blood should move towards the lungs and bodies. So this is the third step, which is ventricular systole. When after this, the ventricles will be relaxed, which is called as the ventricular diastole. So now all the blood is transported towards these vessels, and the ventricles are empty. So that's why it lowers the blood pressure into the ventricles. So that's why these walls are against closed, semilunar walls, and this bicuspid and tricuspid walls are open so that the blood can go from atrium to ventricle, which leads to the again joint diastole. So this cycle is repeated through and through of your life, which last almost around 0.8 second. The duration of this cycle is about 0.8 second, and that's why we our heartbeat is beats around 72 times per minute. So this is about the cardiac cycle. I hope it is helpful to you. If you like this video, please hit the like button, share this video with your friends. Thank you so much for watching. We will meet in the next video by looking more topics about this chapter, in which we will learn about the electrocardiograph and all the things. Till then, goodbye, take care.